All right. Welcome to the live stream tonight. Thank you for joining us. We're here on multiple platforms and hopefully we'll be on all of them. Looks like we're still lagging on one of them, Joshua TV, but hopefully we'll catch at least the last part of it if you can. We are going to look at some specific things tonight. We're going to look at inflammation and immunity, our series on the pain connection, the role of affective immunology in the treatment of pain. Now, this is the biohackerPT, just one T. And I'm the commentary person, the commentator, who will be guiding you through this process. We're looking at specific types of moods, different negative emotions that could be affecting you in your pain, in your inflammation, in your immunity. Now, is that affecting you? Now, this is the second part of our series. The first part we did on Friday night. Now it's Sunday night. Now we have already gone through the different topics, such as the vegan kitchen. We did that yesterday. And then we also did some vegan grocery shopping earlier today. So please join me on the chat. Now on the screen above, you can join me via the Discord server. I have a specific one just for you. This one is called the biohackerPT hashtag or #7376. The other one is well, the address is there, and then the other one is using the chat, of course, on the multiple streams: Facebook Live, YouTube Live, Joshua TV, Periscope, as well as Twitch. We want to welcome those specifically, and especially those ones over on the Twitch platform. The reason why I want to invite you is because we want to have you participate with this in some way, in some fashion. Now, let's go ahead and go into the main event. There is so much information that we want to share to you tonight, and we will probably run out of time. We're looking specifically at the negative emotion, anger. Have you ever been angry so much at someone that it sometimes just irritates you to the point of endlessness? Well, that's what we're going to talk about today. And specifically, we're going to talk about how it affects you in your immunity and your inflammation. Now, over this series, we know that we cannot just take care of decreasing inflammation. Inflammation sometimes is important. We can't just boost our immunity, especially because that can actually cause an overreaction. In fact, the most current pandemic style disease right now is affecting those people in certain ways, and sometimes you can get an overreactive immunity. They call it a cytokine storm. Now, you might have an anger storm right now against someone. So this is a topic for you. Now, we're going to look at different things on the screen here, if I can get it on here. It is a late night broadcast for sure, and it's probably a little bit different for you as the time has changed for most of those who are in the United States. But we will want to go ahead and see if we can enhance our brain activity this evening by participating as you will on the chat and having a little bit more upbeat or mood music, I would say, the least. So let's begin. Let me feel if we can find the presentation for the Pain Connection slideshow. Now, I debated on the topic here, and it could be another way to say it is, does anger affect your pain? All right? Affect your immunity, affect your inflammation. And it could, but it shouldn't, but it will, or it has. All right, so let's now change screens. Let's move forward in time and go to the main event. Let's see if we can fade this in. Don't forget some of that information there. And it will be also on the top of the screen still on how to join us here. Now, how can we get this on the screen better? Let's see if we can choose a slideshow that presents itself. All right, so here it is, the Pain Connection, PT Biohacks, or sometimes I call it for short PT Hacks. All right, let's just make sure that the color is fine. We don't have the partner here to more or less straighten that out for me. And I'm just going to wave my hand a little bit and just make sure that the lights are okay. We've been playing around with the sound and the lights for a while now, and hopefully we have gotten that. Looks like Josh Who TV is still spinning and waiting for action, and I'm not sure why, but that's okay. We will see if we can find a quick way to resolve that. It looks like that is not resolving, but that's okay. We will continue forward. Hopefully you are on other streams as well. Please give me a thumbs up, more or less, with the chat if you can, and if the sound is okay. And if you actually saw some of the other videos earlier from this week. Now let's go ahead now and look at this here. Now I wanted to make a separate category, but it's still under this functional approach, looking at biochemistry and neurophysiology in the broad sense, but looking specifically or more generally in the biopsychosocial model for pain, and we can look at that as we look at some of these specific neurotransmitters, the specific hormones, and specific techniques that we could look at for treatment. And we're looking specifically at this one, affective immunology. Now, if you have stress, we know that there's an increase in cortisol. Now, that cortisol can affect your body in different ways, and other ways that we will be mentioning. We've been talking about cytokines, specifically looking at IgA and IL-6. These are some of the ones that are affected by our topic for today, anger. Okay. I'm looking for, let's see here. Yeah, that was it. So we want to go ahead forward here. One moment. Let's just make things a little bit more effective here. It sounds just so quiet talking to myself. There we go. Now the sound might be a little bit on the loud side. right, here we go. Now, let's go to the main event. We've been looking at our search engine, Josh Hu. And Josh Hu, if we can get his channel working for the live stream as it connects to Restream, we are looking at the topic of anger, inflammation, immunity, and pain. The date was on the 30th, on Thursday, I believe. Right. Payday was on Friday, so maybe it was Friday. Okay, so we looked at the search engine. Let's open it up just real quick and see these articles. Now, on day one, we looked at all of these ones that are mentioned here. Chronic pain when your body gets angry. Anxiety, not anger, induces inflammatory activity. Emotions like anger and sadness may cause pain, as well as being stress, inflammation, immunity. Anger more harmful to health of older adults than sadness. Anger and sadness may cause real pain, as well as being and then we skipped that one and we skipped this one here. We'll be talking about that one, maybe even jumping into that one very soon, and how it affects the gut microbiota or microbiota, as I say. We did this one here on affective immunology, a little bit of the explanation. We're not having the broader sense of psychoneuroimmunology. I could say that now a little bit better. A little bit was harder than saying that. The role of negative effects on pathophysiology and clinical expression. And I think we ended up on page 2 in dealing with forgiveness from the hopkinsmedical.org website. All right, so we're gonna look here at, it says here, anger, and we're going to the second section here called part 2, and we're looking specifically at this. Now, there's going to be a lot of information here that we'll skip over. It's the role of negative effects in pathophysiology and clinical expression of irritable bowel syndrome. Okay, we're cutting off here, I think, a little bit, and maybe I can see if I can correct that. We are in viewing mode, all right? So we are in viewing mode. So let's go to that article and see what we can glean at this late hour. Now, I'm almost on the mood of skipping a lot, but we'll see if we can get through at least half an hour, if not just cutting off the stream early tonight so you can get some rest, or else you'll be seeing this in a later broadcast as you look at it on the videos. All right. Let's look at this one here on the irritable bowel syndrome. Why irritable bowel syndrome? Could we have a focus on that as maybe something that's dealing with hyperimmunity? And we have. In fact, today in my research, I found out that possibly what I've been using is a little bit on the inflammatory or pro-inflammatory side, and that is because the condition that I have, one of the conditions is eczema or atopical dermatitis, and I've found out that is more of a Th2 dominant type of condition where certain types of things could enhance or increase the itchiness. All right, you know what I mean? All right, so irritable bowel syndrome is regarded as a multifactorial disease in which alterations in the brain-gut axis signaling play a major role. The biopsychosocial model applied to the understanding of IBS pathophysiology assumes that psychosocial factors interacting with peripheral, central, endocrine, and immune changes may induce symptoms of IBS, modulate symptom severity, influence illness experience and quality of life, and affect outcome. The present review focuses on the role of negative effects, including depression, anxiety, and there is our magic word, anger, and on pathogenesis and clinical expression of IBS. The potential role of the autonomic nervous system, stress hormones, and immune system in the pathophysiology of both negative effects of IBS are taken into account. Psychiatric comorbidities and subclinical variations in levels of depression, anxiety, and anger are further discussed in relation to the main pathophysiological and symptomatic correlates of IBS, such as sensory motor functions, gut microbiota, inflammation, immunity, and symptom reporting. All right, so we know a little bit about what IBS is. If you don't, you can read that over. I have all the reference in the reference guide. This particular journal, I believe, is in the World Journal of Gastroenterology. The date is on there, on 2014, something that you probably pick up, on the way home from the grocery store. I don't think so, but we're looking at this as a scientific approach, of course. We're looking at, we already know what the biopsychosocial model is. If you don't, you can read that in here. It is helpful for understanding the bidirectional relationship between mind and body, integrating biological science with individual features. According to this model, illness and disease results from synaptically interacting systems at multiple levels, and research in this field is oriented to determine the ways in which biological, physiological, psychological, and environmental factors interact to explain onset, illness, course, and outcomes, or outcome. All right, so we're going to look specifically at the brain-gut axis, because that sounds so interesting, doesn't it? Well, it does to me, I guess. For those of you who are up and up, we should know that as a physical therapist. If you are a physical therapist listening to me right now, we should know what that means. If you don't, you either haven't gone to school in a long time, or having the appropriate type of educational continuations of courses. Maybe you're stuck in the mode for how to take care of an ACL tear and to take care of a stroke, which may or may not have some new information, but we need to look at some other aspects or avenues that we need to know, because they play such a crucial role in our treatments. All right. So the effect of negative effects in emotional health has been long recognized, particularly the physiological consequences with the effect in emotional arousal. Provide one potential mechanism by which emotional states may influence physical health, leading to increased vulnerability to illness. In general, negative effects are related to unhealthy patterns of physiological functioning, while positive effects are associated with better health. Although the role of other potential mediators of this association, such as healthy lifestyle, stronger social networks, more positive social interactions, frequency of stressful events, and a putative role of PA as stress buffer, needs to be further investigated. All right. So we're looking at some specific things. This is serotonin. We've talked about that before, how serotonin is involved. Let's see here. This is probably the autonomic nervous system. And we are looking further down. I'm looking specifically at, here's another one. It's the hypothalamic pituitary adrenal axis. We've talked about that in the past. Dealing with the adrenal gland, the pituitary gland, the hypothalamus. And we can see all the effects Negative feedback involving the activation of neural, endocrine, and immune mechanisms limits the stress response, leading the organism back to a state of homeostasis. Thus, the ideal stress should response should be time limited. However, if the stressor persists and becomes chronic, the adaptive system becomes defective or excessive, and prolonged activation of the axis and autonomic nervous system alters mood and affect. A loss of cognitive and affective flexibility and inhibition of those vegetative processes that are likely to impede survival of the organism. All right. So let's keep on going here. This endless article, the immune system. So here we go. I'd like to go ahead and review this one, and specifically looking at certain aspects. The immune system is highly connected with other physiological systems and susceptible to the effects of hormones, neurotransmitters, and other mediators. Direct anatomic and functional links between the central nervous system and the immune system provide a biological pathway by which effects, emotions, and psychological distress may influence immunity. Chronic stress is associated with altering immunity and increasing susceptibility of a number of diseases. And there is an emerging evidence that positive effects can moderate the negative effects of stress and immunity. Now we have to, as we went to this last time, we talked about it doesn't necessarily mean that stress is bad. Stress could be good, anger can be good if it's a motivating factor and if you keep things professional and on the lid, of course. But many times, like I said, a person gets under your skin. All right, so those people specifically with skin problems and stress-related skin problems can understand that as well. All right. P as a trait has been associated with increased cellular immunity competence, greater NK cell cytotoxicity, and increases the secretory IgA response to the antigen challenge, increasing the number of helper T cells and antibody levels. All right, so let's just, I don't know, I need to look at let's see here. I'm looking for the abbreviation here that I'm keep on seeing, and I just forgot what its meaning is here. So once I find that, I will go back to where we were. And again, we might be doing a little bit of skipping here because this article is already, okay, the positive affect, okay, positive and negative affect. So let's go back to where we are as we look at this, because time is already a wasting, if you know what I mean, if we talk in a Southernism slang. All right, so here we are. So P, a positive affect, as a trait has been associated with increased cellular immunity competence, greater NK cell toxicity, and increase in secretory IgA responses to antigen challenge, increased number of T helper T cells, and antibody levels. Conversely, the growing body of research has found that negative affects and emotion are associated with immunological dysregulation, and experimental paradigms aim to evoke transient mood changes. All right, goes on and on and on. Okay, so we know that that is, I'm looking specifically at different types of things. So we know with IBS that it's affecting it, right? Okay, we summarize research that has evaluated negative effects or affective symptoms in IBS, specifically addressing depression, anxiety, and anger. These constructs overlap substantially with more general constructs such as psychological distress and with trait feelings or features of negative effect. And here we go, the role of depression, anxiety, and anger in IBS. visceral and pain hypersensitivity, and abnormal colonic mobility. Okay. Abnormal gut microbiota. A link between intestinal microbiota and IBS has been suggested. The composition, reduction of certain of the bacteria that live symbiotically with us, and temporal stability of the GI microbiome community is altered in IBS patients compared to with controls. Recently, the construct of the brain-gut axis has been recently expanded to include microbiota, the gut, in a bidirectional way, and knowledge in this field is rapidly expanding. Now, this is the one that I wanted to go through, inflammation and immunity. We'll go through this, and then we'll move on. The physiological conditions, the gut in its chronic state of inflammation with the balance between commensal microbes and the immune system. Although colonic biopsy specimens are usually abnormal in IBS patients, direct evidence for the role of inflammation and immune activation in IBS has been provided. It is estimated that post-infectious IBS may represent up to 30% of all IBS cases, and sustained immune activation has been found in this subgroup of patients. Furthermore, low-grade immune activation of IBS patients in the absence of an episode of acute gastroenteritis is reported. All right, this is the main event, right? This is the main part. Inflammatory mediators include cytokines, prostaglandins, bradykines, nerve growth factors, adenosine, I practiced that one, and serotonin are all substances involved in visceral hypersensitivity, alterations in motility, increased gut secretion, and possibly contributing to diarrhea. The runs, more or less. Studies focusing on cytokine measurements have shown increased levels of pro-inflammatory cytokines, interleukin-6 and interleukin-8, whereas the presence of extraintestinal comorbidity, include depressive states, is associated with increased levels of IL-1 beta and tumor necrosis factor alpha. All right, so one is in IBS patients in the presence of extraintestinal comorbidity, including depressive states, it is associated with increased levels of IL-1 beta and tumor necrosis factor alpha. All right. A recent study of the correlation between anxiety, depression, status, and cytokines in small sample of patients with IBS-D has shown that IBS-D patients who meet anxiety depression criteria for increased IL-1 beta levels and decreased levels of IL-10 and anti-inflammatory cytokine when compared with controls. The authors have suggested that anxiety depression status may cause changes in the IL-1 beta and IL-10 levels of IBS patients, resulting in an imbalance of pro-inflammatory and anti-inflammatory cytokines, thus leading to aggravation of IBS. And you can see how that is affected in all these other aspects as well. And then also, as we deal with anxiety, anger, and inflammation, which is less known, let's look specifically at anger. Higher levels of IL-6 and C-reactive protein among individuals with higher anger and lower levels of the same inflammation markers among those with higher anger control have been found. Moreover, trait anger and hostility vary positively with levels of CRP and IL-6, suggesting that angry tendencies may confirm much of the variability in inflammation associated with negative emotions. So these higher levels of IL-6 and C-reactive proteins. So that was the main part of that, and we actually took a lot of time for that, but we will move forward and to the next article. Now this one here is quite heavy too. And the reason why I'm going through this one, a review of the emotional aspects of neuropathic pain from comorbidity to co-pathogenesis in pain and therapy. And this is the article in Pain and Therapy. And what I like about this article is the multiple pictures. And we might even just skip to that if we can. I think this is the one that has the pictures. Maybe it's not that one, but it might be the next one. All right, so what we want to do here is let's just see if we can look at least at the abstract. Neuropathic pain is characterized by both sensory and affective disturbances, supporting the notion that pain and mood disorders share common pathogenesis mechanisms. Moreover, biological and neuroimaging data show that common brain areas are involved in the modulation and painful emotional experiences. Improved understanding of the molecular mechanisms underlying the role of neuroinflammation and regulation of affective behavior in neuropathic pain states is important for the development of the novel therapeutic strategies. Psychological issues must be considered a factor to influence treatment and outcome of patients with neuropathic pain. Now, we know about neuropathic pain is associated with a substantial economic burden for both individuals and society. And then it just continues on about what neuropathic pain has done to people. We see there are all kinds of responses here biochemically. And talking about different mood disorders that are associated with this, the pathogenesis mechanism of pain and affective disturbances, peripheral inflammation and affective disturbances, immune to brain signaling and inflammatory cytokines as neuromodulators, inflammatory cytokines and affective disturbances in the neuropathic brain. There's actually a neuropathic brain. Peripheral neuropathy leads to increased expression of pro-inflammatory cytokines as well as increased glial activation within the brain structures, and emerging evidence suggests that neuroinflammation in these brain regions leads to affective disturbances. And then it talks about antidepressants and anticonvulsives. And how that is affecting the tricyclic antidepressants as well as the serotonin, selective serotonin reuptake inhibitors. And that's using other things as anticonvulsives like a gabapentin or Cymbalta, pregabalin or duloxetine, and duloxetine, which is Lyrica. Patients with neuropathic pain often fail to respond adequately to pharmacological treatments, and their pain is therefore termed refractory. Psychological factors as predictors of pain perception. And the conclusion. Let's read the conclusion in this and move forward. Neuropathic pain is widely recognized as one of the most intractable pain conditions to manage, and clinical outcomes often unsatisfactory. Psychological factors such as depression and anxiety must be taken into consideration as factors that may influence treatment and outcome. Moreover, when treating chronic pain, it must be remembered the ultimate goal is not simply to reduce pain, but to achieve better quality of life by restoring normal function and reducing comorbidities such as depression, anxiety, and sleep disorder. All right, so there you have it. Now, you can refer to the psychologist, because you are not a psychologist as a physical therapist. All right, so you have to understand that. And we have that problem sometimes if we believe in the biopsychosocial model, and we'll sit there and we'll listen to you and we'll try to hear all the stories of just this emotional release. And sometimes this emotional release is so much, and it's like you're providing that information to someone who might not have that education, knowledge, and professional experience to cope with that. So we have to understand it, and we have to work around it, and we have to make some suggestions and for when there is professional need. All right, so that is important to know. But again, we have to understand the biochemistry and the neurophysiology and how it affects the body and also how it affects the brain. All right, moving along. We have some time left here still. These are very heavy articles. This one here is going to be the last of the heavier articles, but this one has pictures. Yay, pictures. So we're going to look at the pictures here and see if we can get this one here. This one is from stress to inflammation and major depressive disorder, a social signal transduction theory of depression. All right, so we have to go to this because it is really important to look at this one here. I believe this is the one. Major life stressors, especially those involving interpersonal stress and social rejection, are among the strongest proximal risk factors for depression. In this review, we propose biological plausibility, multi-level theory that describes neural, physiological, molecular, and genomic mechanisms that link experiences of social environmental stress with internal biological processes that drive depression pathogenesis. All right. Central to this social signal transduction theory of depression is the hypothesis that experiences of social stress and adversity upregulate components of the immune system involved in inflammation. The key mediators of this response, called pro-inflammatory cytokines, can elicit profound changes in behavior, which include initiation of depressive symptoms such as sad mood, fatigue, psychomotor retardation, and social behavior withdrawal. This highly conserved biological response to adversity is critical for surviving during times of actual physical threat and injury. However, this response can also be acted by modern-day social, symbolic, and imaginary threats, leading to an increasingly pro-inflammatory phenotype that may be key phenomenon driving depression pathogenesis and recurrence, as well as the overlap of depression with severe somatic conditions, including asthma, rheumatoid arthritis, chronic pain, there it is, metabolic syndrome, cardiovascular disease, obesity, neurodegeneration, everything. Insight from this theory may thus shed light on several important questions regarding how depression develops, why it frequently occurs, why it is strongly predicted by early life stresses, and why it often co-occurs with symptoms of anxiety and certain physical disease conditions. This work may also suggest new opportunities for preventing and treating depression by targeting inflammation. So it talks about depression and how it's bad. And sometimes we'll term that as sadness. That was a little bit more general and broad for the physical therapy realm. And it's, different, of course, but we don't want to belittle it at all. And then here we go with the immune system. All right, so now let's see if we can find the pictures. I think this is the one with the pictures. If it's not, we will move on. So it talks about cytokine. Here it is. All right, here we go. This is more like it. Sometimes it just doesn't show up. I don't know if I just have to make the screen smaller or bigger. But let's just wait until it stops here before we keep on clicking here, and then we can open up these things here. So these are the inflammatory cytokines and their key characteristics. I don't know if I can make this bigger or not. I guess I am. So we know that we're looking at these different ones, the inflammatory cytokines and their key characteristics. the pro-inflammatory cytokines. Now, this is very important. Now, even if we just look at this, we'll accomplish quite a bit tonight, and this will be a one for the record. Okay, so interleukin 1 beta or IL-1B, the producer cells or the macrophages, key mediators of sickness behavior, promotes fever and pain hypersensitivity, involved in the HPA axis activation, lymphocytic activation, macrophages and neutrophil activation, endothelial activation, prostanoid synthesis, and IL-6 synthesis. The next one is interleukin 2. All right, it's family, and it is the T cells that are the producer cells of this. It facilitates immunoglobulin production by B cells and differentiation of proliferation of NK or natural killer cells. Interleukin 6, another important that we've already talked about, and these are produced from the macrophages and T cells. Key mediators of acute phase response, promotes fever, and B and T cell differentiation and activation, can downregulate inflammation by inhibiting TNF alpha and IL-1 production. All right, the interleukin 8, these are in the macrophages. We will skip that one. No, we won't. The key mediator in inflammation. The key mediator of inflammation recruits neutrophils at the site of the inflammation and induces chemotaxis in targeting cells. Tumor necrosis factor alpha in the macrophages in the natural killer cells. Key mediators of sickness behavior, promotes fever and suppressed appetite, stimulates the HPA axis, endothelial activation, and neutrophil activation, inducing apoptotic cell death, so the collection of the dead cells. Now, these are some of the anti-inflammatory cytokines. Interleukin 4, so you can look at that. Interleukin 10, that's an important one too, because this interleukin 4 is from the T cells, and then the interleukin 10 is from both macrophages and T cells. Inhibits the production of pro-inflammatory cytokines, and this is also how it is mentioned here. Also, this one stimulates and this one enhances. Stimulates B and T cell proliferation. This one enhances B cell proliferation and antibody production. So let's look at the next one. This is the little one that is probably going to be our ending one here, because I really like this one here. And this one is describing, I think we can find it here. So let's read the bottom infograph information here. Conserved transcriptional response to adversity. The innate immune system developed to counter physical threats from predatory animals and hostile conspecifics that dominated our ancestral environment. Exposure to these threats activated the CTRA that involves upregulation of pro-inflammatory immune response genes, which combat extracellular pathogens and wound-related bacterial infections, and downregulation of antiviral immune response genes, which target intercellular pathogens such as viruses. This redeployment of leukocyte basal transcription or transcriptome is adaptive in the context of actual physical threat because it enhances wound healing and recovery from injury and infection. Wow. Even myself, that was just a brain load, I guess, of just what they said there. But I like the pictures because there's a picture of a monkey and a saber-toothed tiger and the guy with the the arrow pointing at you. These are the contemporary threats. Someone's shouting at you, or you shouting at them, I guess. And then the gossiping here, and then also the isolation. So conserved transcriptional response to adversity. Okay, so there's an increase in pro-inflammatory immune gene response to combat wound-related bacterial infection, for instance. And then we have the antiviral immune response genes, and these target viruses and other intercellular pathogens. Short-term benefits: responding to actual physical threat, enhanced wound healing and improved physical recovery, greater likelihood of survival. The long-term detriments, I guess, would be responding to perceived social threats, greater inflammation-related disease risk, increased vulnerability of viral infections, and a lower likelihood of survival. All right, so this one here talks about the threat, increase in cortisol and the recovery, and then the increase in the cytokines. This looks very similar to the response of the two phases of COVID right now. And this could go way off the chart. So cortisol and pro-inflammatory cytokine responses to social cues indicating possible danger. All right. So we don't have time to look at all of that unless it specifically talks about anger in this picture or any other things that we had. So here it says here, although these dynamic and adaptive during actual intermittent physical threats, prolonged activation of the HPA axis, and inflammatory response caused by persistent actual or perceived threat is biologically costly and increase the person's risk for several inflammatory related conditions, including, here we go, asthma, rheumatoid arthritis, cardiovascular disease, chronic pain, metabolic syndrome, and possibly certain cancers. All right, so we have that as well. And then we have here as this picture here, this is the neuroinflammatory sensitization and the physiological recursion. And we have IL-1 beta, IL-6, and TNF alpha. And the cognitive, emotional, and health effects. Short term is hypervigilance, anticipation of adversity, sensitivity to pain, and social anxiety. The medium term is disrupted sleep, chronic pain, depressed mood, social withdrawal. Long term is susceptibility to infection, inflammatory diseases, accelerated aging, and early mortality. Neuroinflammation, sensitivity to adversity. All right, so we have this bidirectional link between the brain and the periphery, allowing the brain to regulate inflammatory activity, and inflammatory activity in turn to influence the neural processes in the brain. It's dynamic. And then it has the whole issue with the which promote the pro-inflammatory skewing of the leukocyte basal transcriptome that feeds back on pain-related neural systems to perpetuate subjective perceptions of threat. All right, so we go through that as well. Finally, after years of sustained engagement, these dynamics may confer increased risk for inflammation-related disorders, infections, accelerated biological aging, and early mortality. Okay. Almost done with the pictures, and I think we will be closing here soon. We'll have to see how it goes as we speak. And the body is amazing as we look at all the different things here. Social stressors, talking about the cytokine-producing cells, the nucleus and the cytoplasm, and how the mRNA is involved with this. Social signal transduction theory of depression. Okay, this is just dealing with this specific theory of depression and leading to activation of pathways leads to production of corticoids, epinephrine and norepinephrine, and acetylcholine, which interact with receptors of cytokine-producing cells. And it's just talking about the three pathways that involve the hypothalamic pituitary adrenal axis, the sympathetic nervous system, and the efferent vagus nerve. Now we will talk about later on specifically the vagus nerve and how that is in its role with dealing with pain. All right, so again, dealing with those pro-inflammatory cytokines. Cytokines can exert these effects on central nervous system by passing through leaky or incomplete regions of the blood-brain barrier, and by stimulating primary afferent nerve fibers in the vagus nerve, which relays information to the brain system, regulates mood activity, mood sensitivity, social threat, and arousal. All right, so it just goes on and on about that. All right. So then the promotion of disease. All right, a little bit more than I can handle on that one. And let's look at the last one here if we can. Let's see if we can just take it as is. Genetic factors, personality traits, social environmental conditions through childhood. We have the through adolescence. We have elevated inflammation, and through adulthood, anxiety and depression. The effect is circle here: mild inflammation, anxiety, and perception of social threats. And then we're looking at how this is all affected. Elevated levels of perceived or actual perceived threat that results in these factors are hypothesis to increase feelings of anxiety and activate social signaling transgression pathways and upregulate inflammatory activity. So it's this circle, the circular type of thing that goes on and on. From this perspective, genetic, personality, and social environmental factors early in life promote elevated perceptions of social threat, symptoms of anxiety, and preclinical levels of inflammation. Then, at least for some individuals, anxiety symptoms may become eclipsed by symptoms of depression that include sad mood, fatigue, altered sleep, and appetite, and social behavioral withdrawal. And I don't even know what this word is. Anhedonia. If it deals with hedonism, maybe we can look at that word maybe later on in the definition of that. All right, so this one here, we're not going to spend much time with this one. This one I came across, and it seemed to be very interesting, and that this is less on the side of science or scientific, but more practical. Okay, so let's just read the abstract at least. The intent of this paper we'll discuss. This is in Natural Medicine Journal. And again, the reference here is the date on the August 2017. This paper will review the studies of the effect of various types of men's anger and anger expression on the cardiovascular system, which is the most well-studied system affected by anger, including acute coronary pathologies, as well as chronic conditions secondary to anger. Research studies on the effect of men's anger on the immune system, pain, erectile dysfunction, and risky health behaviors will also be discussed. Understanding the main negative consequences of anger on the man's body will highlight the importance of addressing this aspect of men's health while caring for our male patients. Now, I deal with all male patients in the facility I work at. All right, so you can kind of guess where that might be. Okay. All right. Introduction. Anger pathways. The immune system is also affected by anger, especially suppressed anger. Given that anger is a common response to cancer diagnosis, it may be useful to design studies to look at the potential immune system benefits of more effective anger expression in men with various cancers. Okay, so that's the main highlight on that. All right. Cardiovascular effects on anger. We can look at that. We're not specifically looking at as it relates to pain, and that is that immune system effect on anger. We could look at that as well. All right, suggesting a relationship between suppression of anger and natural killer cell toxicity. Another study looked at the inflammatory activity, IL-1, IL-6, and interferon gamma, based on induced anger and anxiety, anger and pain. So let's look at this one. Many studies have affirmed the relationship between anger and pain, which over the course of years has become more nuanced, depending on the manner of which anger manifests, anger in or anger out. Those who express anger outwardly show greater pain sensitivity than those who express anger inwardly. Interesting. I think it would be the opposite. Interesting. In a 2014 study, Burns, Bruhl, and Conte looked more specifically at the physiological mechanisms that may determine pain responses to anger. The study of 146 participants, 54% men, looked at the role of endogenous opioid system dysfunction in those with higher anger trait anger when induced into a state of acute anger. Results of this intricate and quite complex study indicated that people with higher trait anger and anger out tendencies, when induced into an acute episode of anger, actually showed lower pain intensities. Interesting. The result of the intricate and quite complex study indicated that people with a high trait anger and anger out tendencies. This is intriguing and that may indicate that people with higher trait anger have compromised endogenous opioid analgesia, and therefore an anger outburst may be a way to moderate pain, albeit not the optimal way given the totality of the anger's effects. So let's think about that. Sometimes when people are depressed and they have sleepless nights and they come in and they seem angry, they look angry, and they might be actually using that to modulate or to moderate their pain. Interesting. It's something that is interesting. Now, another one here, we talked about rheumatoid arthritis. All right, let's look at that one. In 2016, a study looked at anger expression styles and symptom severity in the rheumatoid arthritis and asthma. The results showed that especially men with those high in anger had an increased frequency and intensity of momentary anger throughout the day. Okay, the authors observed high trait anger in predicted increased physical limitations such as asthma-specific symptoms in daily life, while higher anger trait out predicted reduced RA-specific symptoms. Again, anger out. One clinical application of the study would be to employ therapies to encourage anger expression, talk therapy support groups to moderate symptoms with men with RA. So this one here is the anger out. All right. So we observed that higher trait anger in predicted increased physical limitations and asthma-specific symptoms in daily life, while high anger out predicted reduced RA symptoms. So with RA and asthma, it looks like the anger out is the one. All right, so we're looking at that. Again, with the immunity, we have the relationship between the suppression of anger and natural killer cells cytotoxicity. Natural killer cell cytotoxicity has been used as a prognostic indicator for cancer progression, and while other psychosocial factors have been considered in the relationship to the natural kill cell cytotoxicity. All right, so that is that one there. We'll skip over the erectile dysfunction one, and then we'll look at the conclusions here. Over the course of history, research has shown more clear connection of anger, not simply overt expression, but inward expression as well, to a wide variety of pathologies. Most of the research has been done on cardiovascular pathologies and secondary conditions of poor cardiovascular health. While the evidence is strongest for acute coronary vessel pathologies such as MI and cardiovascular effects of increased sympathetic nerve stimulation, especially in the 2 hours following anger episode, there is convincing support for the consequential effects of trait anger towards cardiovascular damage. All right, such physicians would be well advised to consider anger, hostility, and depressive symptoms as a risk factor for the development of cardiovascular disease, especially in patients with established cardiovascular disease. There is evidence for correlations of anger in diverse forms to increase immune function, especially natural killer cell cytotoxicity, and increase pro-inflammatory cytokines. Also, angered patients who expressly outwardly have greater sensitivity to pain, with the interesting finding that those with high trait anger may have dysfunctional endogenous opioid systems. All right. Given the current focus on pain and addictions, the opioid pain medication is another area that needs to be in further research. Anger is also increases symptomatic expression of rheumatoid arthritis and asthma, especially in men who tend to hold anger in. This may become increasingly common because of the current decrease in tolerance of men negatively towards expressing outward anger. While there is sparse evidence for a strong correlation of anger in ED, though more stirring data link anger to variant sexual behavior in men. Finally, anger in men leads to risky health behaviors, possibly due to the effect of anger on decision-making in areas of the brain. In conclusion for tonight, there are evidence that anger in the form of acute anger explosions, hostile, chronic anger, or various methods of anger expression is detrimental to men's health, Clinicians should heed the evidence on the ramifications of anger in the body and consider therapies that address all. All right. Now, we didn't have time to look at this last one on Mercola because we have run out of time. So we will close. Let's see. Maybe we will have a little bit of time. Let's just see. All right. So this is an article that deals with the science of anger. Please look at that if you wanted to. And it just talks about how we can look at the science of anger, how it affects your blood pressure and your heart rate, and the importance of your frontal cortex. And we can utilize different things like eating a healthy diet, getting enough sleep, getting regular physical exercise, managing your daily stress. And when anger strikes, stop and take a few deep breaths to reoxygenate your brain before responding. It says short fuse people live shorter lives. It contributes to arteriosclerosis. It looks at a study that's big that deals with that as well. It says it's not just about being angry occasionally. These people were likely to have been consistently angry. It's okay to have a cross afternoon or even a year. It's okay to have a cross afternoon or even a year. This question may capture not transient anger, but preposition of anger. So it says that even intense bouts of anger has its risks. In one study, the individual risk of a heart attack rose nearly 5-fold and the risk of stroke increased more than 3-fold after 2 years following an anger outburst. All right. Other negative emotions such as depression and loneliness have been linked to a higher risk of heart disease and stroke. Suppressing negative emotions make matters worse. We found that people who habitually affect their negative emotions may experience fewer negative emotions, which add up to their better psychological health. Maybe if you have an accepting attitude towards negative emotions, you're not giving them as much attention, and perhaps if you are constantly judging your emotions, the negativity can pile up. When you try to deny or stifle any part of your self, whether undesirable emotions, desires, or fears, you become fragmented, but you need a sense of integration, of wholeness inside to grow your well-being and capacity to handle the ups and downs, the success and failures, and part of relentless change and impermanence that characterizes life. So a practice of meditation and yoga. And then it says here, is most back pain caused by repressed emotions? Repressed emotions such as anger, fear, frustration, and rage may also be a factor contributing to chronic pain, especially back pain. All right, so this is an article that's in there as well. Chronic anger may increase your risk of dementia. And then the mapping motions of your body. The mapping exercise is talking about that. And it is important to nurture emotional wellness, certain techniques that could be done. Make a point of being more mindful, focusing on what you're doing and the sensations you're experiencing in the moment, which can improve your mental and emotional outlook. We talked about how the monks can just turn the meditation quickly on and get into that quiet place when they have those stressors that are affecting them. There's almost ancient wisdom in the two-word question, so what? So when you think about it, there are millions of ways to apply it, right? As she writes, these two simple words can cure your anger. So what means don't worry about other people. Everything is okay. Talk about the Buddhist style edge. Now, let me ask you, what are some situations you can apply? So what? All right. So this is Susan Moore, the greatest life coach, columnist, and confidence coach. All right. So we did finish all of them, and we will go back to our pictures. And I like this one, I think, is the most let's see if I can go ahead and make this a little less ominous and big and more specific here. Let's see what that does. I probably had it just right, but then I decided to do a different thing here. So, there we go. All right, so we will look at that. Let's make that a little bit on the smaller side if we can. All right, so we will transition the screen. We never made it on Joshua TV, but nonetheless, you do have YouTube and other avenues that you can listen in the future. And let's see if we can move forward into the last phase before we close for tonight. So here we are again in the late night broadcast. And we're here to see how the body is affected through these stressors, these negative emotions. How are you affected? Are you affected by these physical threats? The contemporary threats? Is your inflammatory immune response out of control? And do you have that decrease in immunity? Now, some of this can be good, but after a while, it can be bad. Now, we even discuss how even a short outburst of anger can affect you. So we want to know, what is the key? What can we do? We talked about that and how you can control that through different means. Dr. McCullough gave some information. And if we control our own negative emotions, we can help those who are around us and those who are in pain. Now, instead of me preaching, I will tell you that I need to do this as well. And over this weekend, and over again, as I discuss this topic, I have been letting go of my anger. So you out there, the one who has been holding my anger in suspense, I will release that anger. And hopefully, even though things can come my way, I will be in meditation and peace at where things are. And accepting that can help us to move forward in greater life and longevity. Again, we point to who and how we find examples in history, in literature, in who we associate with and who we read about. And in this situation, we can even look deeper into the canon, the texts from ancient times of those individuals who transcended this world in peace and harmony and homeostasis. Let's take those people and their example, put them into our own character and our own lives, and find that spiritual, ultimate hack connection in order to decrease those negative moods, emotions, and affects that we might choose life. Take care, join me next time, and have a wonderful, safe winter as it moves through. Good night. Have a safe and happy week. Join me again next time.